Hey there, it's Elsa McLean, physical therapist and yoga teacher. Today we're going to talk about what scoliosis is and why more people actually have this diagnosis and may not realize it, and it may include you. A large percent of our population has some form of scoliosis, which is essentially some type of curvature of the spine, or what you may feel in your body is really a different side to side. So if you've ever felt like you can turn your head easier to the left versus the right, for example, or you notice one shoulder sits higher than the other, or one pelvis, or a lot of times in the clinic I have patients that tell me, look, on my back along the spine, I have one set of muscles that are much bigger and thicker than the other. And actually I find out that sometimes it is the muscles that are different side to side, but a lot of times I find that it's actually the bone or the rib cage that they're looking and seeing and feeling, and it's because the spine is rotated. So if you feel any of that, just stay tuned, because I'm going to explain what it is and why you might be feeling some of these things. And then in video 2, we're going to talk about what you can do for scoliosis. If you have any questions at any time, you can always comment below or just reach out to me. So scoliosis, as I mentioned, is a curvature of the spine. So let me show you by example. So the spine from the side view, so from this side view, should have 3 curves. So your neck has a natural lordosis or curve from the side, your mid-back has a curve from the side, and then your low back has a curve from the side. And these are the normal curves that help to hold us upright, absorb shock as we walk, and all this sort of things. It supports the spine. I won't go so much into depth into this, but what I will talk about is what the difference between these curves and scoliosis. So scoliosis, if you're looking at someone from the back, I'm a horrible drawer, I apologize, but if you imagine this person is from the back with their hair, they're losing some hair, it appears. Their spine can curve in that mid-back area to the right, for example, and then sometimes down lower into the lumbar spine. And so this is the traditional scoliosis curve, as you can see, if you look at someone from the back. So traditionally scoliosis is known as that S-shaped type curve. Now, what I find and what I see in the clinic is that there's many different types of scoliosis curves. So for example, in my own body, I have a mild C-shaped type of scoliosis curve, meaning that on my left side of the body, it actually curves like a C. So my left shoulder sits higher, my left pelvis sometimes sits higher, and my right side is very squashed, which can lead to pain in the neck, for example, or pain in the low back, or nerve thing, or the disc being pushed to one side just due to pressure. So that's why you would want to be concerned about this, or pay attention if you're noticing these asymmetries in your body. What happens if you don't do anything about this and you notice these asymmetries, or a doctor even told you had scoliosis, is over time, gravity just pushes down on us. So if you think about our grandparents, a lot of times as they age, they get shorter, right? Because gravity is just taking its toll on us over decades and years. So if you have a curve, it's just going to get exacerbated. It's just going to get worse, and the degree of the curve will increase, and the space in between the vertebrae and the space for the discs will also decrease. So if you don't do anything about it, you just run the risk of having any type of disc issue in the future, nerves getting irritated. If you already have existing pain that comes and goes, it might end up being more frequent, all this sorts of stuff. So if you want to learn more, then stay tuned. Keep an eye out for video 2, where we'll talk about what to do for scoliosis, because there is actually a ton you can do for scoliosis. So don't let any kind of doctor tell you, oh, it's just how you're born, it's just your body, there's nothing that can be done. There's a ton of stuff that can be done. So if you're interested in learning more, comment below so I can make sure you get that second video, and stay tuned. Have a great day. Bye.